Okay, welcome to JC Connect. In the previous class, we were discussing about the water treatment units. Okay, in that water treatment units, till today, we have completed starting from the aeration. So we have completed screening. We have completed the sedimentation, and we have completed the coagulation, come sedimentation. Then we have completed the filtration process. So here we have discussed the slow sand filter and we have discussed the rapid sand filter. Okay. Of course, the theoretical part we almost covered. Okay. Based on this, we'll take up some more numericals, maybe after completion of this disinfection. So why I'm keeping the problem part side is that, okay, those who are targeting the problem part, okay, so they can concentrate on all the aspects, all the units. Okay, so then we'll move on to the disinfection process. It's a hierarchy. Okay, even your treatment plant, water treatment plant. Okay, um, it should satisfy all these units. Whatever we covered, it should satisfy all those units. Or even the hierarchy should be from this to this side. Okay. So of course, we know that the aeration. So aeration is going to remove the odor and it is going to remove the iron also. Here in the screenings, we are going to remove the sand particles. Here also we have the major classification of coarse screen and fine screen. So based on the size of the particles, we are removing um, the sand as well as the salt particles. Sediment. The sedimentation under the influence of the gravity, some particles are going to settle. So that particles we are removed. In coagulation, those particles will not settle under the influence of the gravity. That can be removed in the coagulation process. Means the particles which remained after sedimentation process, that can be removed in coagulation process. Then the filtration process, here some particles are going to escape from even sedimentation process, even from the coagulation process. So that even from the screening process also. So that particles we are going to remove in filtration process. And the slow sand filtration is recommended for most of the pathogens. Okay. Then rapid sand filter, some of the particles which are escaped from the remaining units from screening, sedimentation and coagulation, so that can be removed in rapid sand filtration process. Suppose see, I said that slow sand filtration is process which is recommended for remove pathogens. That differentiation also we did it. Okay. Suppose instead of slow sand filter, if you recommend it for rapid sand filter, then the removal of pathogens, the efficiency of the removal of the pathogens is very less. If that is the case, then what will happen is that the pathogens will escape from this rapid sand filtration process. Okay, for example, if E. coli is there, okay, assume that if the E. coli is there, okay, E. coli is one bacteria which is responsible for the causing the dysentery diseases. Okay, it is causing the, for example, if E. coli containing water, if you drink it immediately, the dysentery will start. Okay, this will escape even during rapid sand filtration process. Then how to remove this? Okay, for that we have to provide one disinfection unit after filtration process. Okay, So then, what is the disinfection? Disinfection is the killing the pathogenic organisms. You can call it as killing the pathogenic organisms. Killing the pathogenic organisms. Okay. Then we will go ahead with that disinfection unit. The disinfection of water and wastewater is the destruction of waterborne pathogens. Well, remember this. It is the destruction of waterborne pathogens, which accomplishes its purpose by physical and chemical and not biological means. Okay. So it is the killing the pathogens with the help of the physical activity and chemical activity. Remember this. We'll see that how the physical activity is going to happen, how the chemical activity is going to happen. When you add any disinfectant to a water, okay, there are two reactions are going to happen. One is physical reactions and one more is chemical reactions. What are those physical activities and chemical activities? Okay, that we'll discuss whenever the um, activity of the disinfectant on the pathogens. Okay, so it refers to a selective destruction of the diseases causing organisms in water supply and wastewater effluent. Okay, see, even in the wastewater, if you are removing the pathogens, the disinfectant will be used. Even in water, even in water, if you are even in water, if you are removing the pathogens, the disinfectant will be used. The disinfection of water is without doubt the most uh, weapon in the hands of the health and water authorities against the waterborne infection. Okay, so in particular, the chlorination of water led to the substantial eradication of waterborne diseases at a small cost in equipment, materials, and in personnel also. So normally the chlorination will be used. We'll see what type of how many disinfectants are there, that we'll discuss later. Okay. So normally the chlorine will be used. Okay. The chlorine Cl2 will be used as a disinfectant. Remember, chlorine will be used as a disinfectant. Okay. However, chlorination may result in the formation of chlorinated hydrocarbons, some of which are known as carcinogenic or cancer producing also. Okay, therefore the alternative method of disinfection is receiving a great deal of attention. See, of course, nowadays the bleaching powder has been practicing. uh, Bleaching powder is nothing but the formula of bleaching powder CaOCl2. Okay, CaO is nothing but it is the unhydrated lime. Okay, unhydrated lime, unhydrated lime. So in that Cl2 will be there. Okay, so in bleaching powder you have two components. One is CaO and one more is Cl2. Okay, so they will take the lime. Okay, they will take the chlorine gas. Okay, and they are going to introduce into this. Okay, that is why always if you see the bleaching powder, it is always white in color. Okay, so white in the sense even the lime is also white in color, and under pressure the chlorine gas is going to introduce into the lime powder. Okay, then it will be packed up so that the chlorine should not escape. Okay? And always remember that if you um, open, you are not supposed to open the packet every time, the whatever the bleaching powder. What will happen is that the chlorine always the tendency is to escape. Okay, the tendency of the chlorine is to escape from that bleaching powder itself. Okay, see, most of the time what will happen is that if you are using the bleaching powder for disinfection, okay, remember that once you use it again, you have to pack it properly. You have to pack it properly and you have to keep it in some dark place itself. Okay, you have to keep it in some dark place because it is a light sensitive. uh, Suppose if you open as it is, suppose if you take some amount of bleaching powder and if you open the packet as it is, then there within 1 hour the chlorine will not be there. Only the CaV will remains. Only you can say it is CaV will remains. Okay, that things you have to do whenever you are using the bleaching powder as a disinfectant for the removing of the pathogens. Okay. So the primary concern of the disinfection is to prevent the direct transmission of disease to man through a water and to break the chain of disease uh, and infection by destroying the responsible infective agents before they reach the water environment. First one, so to prevent the transmission of the disease, see once the pathogen is killed, so once the pathogen is killed, so you can say that almost reducing you are reducing the transmission of the disease. Okay, and to break the chain. Okay, one is this aspect to prevent the direct transmission of the disease. Second one, to break the chain. Okay, these are two very important aspects where the disinfectant will play a very important role. Okay, so that thing you have to keep it in mind. Okay, a disease which is caused by the viruses. Okay, we already know some of the COVID-19 or the some of the its variants. Okay, even that can be killed by this chlorination process. Okay, so bacteria, fungi, protozoa, and helminths, after being transmitted from one host to the other host, is known as infectious disease. Okay. See, always what we can talk about this viruses, bacteria, fungi, protozoa, and helminths. See, it requires one host to survive. Okay. So nowadays, the human beings itself is a host for example, virus if it is there. Okay, so it is transmitting from one person to other person. It means that so it will not survive anywhere, so it requires one host to survive. So the human beings act as a host, okay, for the survival of the viruses. Okay, and host to host it will transmit. Okay, so if you want to kill those things, okay, for example, water environment itself is a host. Okay, water environment is a host. Suppose if you drink the water containing the viruses and all those things or the bacteria, so it will transmit. Okay, so these may be mild or severe or related to the host itself. Most of the time, what will happen is that the host I said is a human being. Sometimes, if it enters to a human being, sometimes it is dangerous. It will be sometimes it will be mild. It depends on the immunity power of the human beings. That always we have to think it that. Okay, if the immunity power is more, normally the survival is more. Okay, and death rate will be very less. Okay. So very important thing is study of the cycle of infectious disease is very important as far as the disease control is concerned. Okay, say this is very important. The study of the cycle of infectious disease is more important. So some of the terminologies when we are talking about the epidemiology. Okay, this is very important. Of course, in detail is not required, but at present situation, okay, some of the concepts related to the epidemics, okay, it is required. So because of that reason, I took this slide. Okay, so some of the terminologies we should know when it comes to the epidemics or this pandemics. So an infectious disease is a change in the normal death health. Okay, the change in the normal health in which part of the whole of the body of an individual does not function properly due to the presence of an infectious agents or the its product. So when you say it is infected means, okay, your body functions will not be a normal. Remember, okay, so the body functions will not be a normal. say some of the body functions will be a regular, or if it is a normal, then we cannot say that it is the infectious disease. Okay, the phenomenon of growth, multiplication, and the establishment of infectious agents in a host tissues or within the cells is known as infection. Okay, so when you say it is an infection, so for example, if you have one bacteria is there, okay, from it is one host, it is there, host 1. Okay, what will happen is that it will take one host is going to make 5, 1, 1, 2, 3, 4, and 5. Okay, 1, 2, 3, 4, and 5. So here 5 hosts are there. So one bacteria is going to multiply 5. So then it will be affected to this 5 persons. Okay. Then it is going to change the body functions of all these 5 um, 5 hosts. Okay, again this is also host, then host 1 is already there, host 2, 3, 4, 5, 6. Okay, it is going to change the body functions of the host 3 itself. Okay, then we can call that as a infection. Okay, so always this infection is going to happen to a tissues itself. Okay, when a microorganisms or agent lives on an expose or in on expense of the host, that drives nutrients for its growth called parasite. Very important. See, um, see one bacteria, I said that it is living on host 1. Okay, suppose if the bacteria is multiplying 5, okay, this one bacteria is multiplying 1, 2, 3, 4, 5. How it is making? Okay, with the help of, so with the help of the food. So what it will do, it will take some food. Okay, then the food is going to supply by the, okay, the parasite. Okay, the nutrients will be provided with the help of the parasite. Okay, if the parasite or its products cause disease, the former is known as the pathogen. Okay, so there are a lot of differences there. So what is pathogens? The pathogen organisms. Okay, for example, see, whatever the parasites or its products which causes the disease, the former is known as the pathogens. Okay, the pathogen is caused by the parasites. Okay, see, when this bacteria also we can call it as parasites. See, normal parasites means the bacteria which requires host to survive, and that host itself acts like a food for this microorganisms or the parasites. Okay, then the ability of the pathogen to cause the disease is termed as the pathogenicity. Okay, then the process of the disease development is known as pathogenesis. Okay, then epidemiology. Okay, so epi means upon, demos means the population, logy means study. Okay, it is science that deals with the occurrence, determination, and distribution and control of the disease. Remember, okay, complete study, it is nothing but how the occurrences happened, how the occurrences happened, and how it is determined, how it is distributed or how it is transmitted, and how the disease can be controlled. The total complete study we can call it as epidemiology, starting from starting from the starting from the occurrence to till control. Okay, we can call it as epidemiology. When a disease occurs occasionally and its irregular intervals in a human population is known as sporadic disease. Okay, it is very important. So when disease occurs occasionally and at irregular intervals in a human population. Okay, for example, typhoid. What will happen is that for the typhoid, what will happen is that so the fever will come for about 2 to 3 days, and again fourth and fifth day it won't be there, then again it will come back. Okay, at irregular intervals, not regular intervals, remember this. Okay, this is very important. It is the irregular intervals. For example, after 4-5 days it won't be there, then again it will be 6 days. For 6 days again it will come back, and it will be by longer for about 15 days, or it will be there for 1 month. So then the normally will go for the blood test. Okay, then they came to know that it is the typhoid. Okay. So then that disease we can call it as sporadic disease. A disease maintaining a steady low level frequency at regular intervals is called endemic disease. Okay, so endemic means it is going to end, the disease is going to end. You can just assume that the disease is going to end. Okay, so normally it's a common cold. Okay, some common cold it will be there, it will be there for about 5-6 days, and it will be ended. Then a sudden increase in the occurrence of a disease beyond a limit is called epidemics. Okay, sudden increase in the occurrence of a disease beyond a limit is called epidemic. Okay. If the occurrence of the disease increase within a large population over a wide region is called a pandemic. So now we talking about this COVID-19. So this COVID-19 we can call it as a pandemic. Why? Because it is occurred, okay, with a larger populations. See, even the single country is left with this COVID-19. Okay, so within a large population or a wide region. Okay, okay, with the highest population with a wide region, and for see time is, you can call it as interval is little bit higher, even it is there for the longer days. Okay, so that we can call it as pandemic. Okay, so epidemic means it is the sudden increase in the occurrence of the disease beyond a limit. Okay, that we can call it as epidemic. And the pandemic is the disease which is going to increase within the large population over a wide region. Okay, so then this frequency of disease, okay, the frequency of disease refers to its repeated occurrence as a fraction of a given population. Okay, so by measuring the frequency, one can speculate how severe a disease is. Okay, it is also related to the morbidity or the mortality rate. It's very important. Always you have to talk about the mortality rate or the morbidity. Okay, any disease, it can be calculated with the help of the how exactly the disease is coming repeatedly for a given population, how exactly it is coming. Okay, in a for a given population in a short time. Okay, so then how exactly it will be measured? So morbidity rate is nothing but number of new cases of a disease during a specific period in a population. Okay, then total number of individuals in the population. Okay. For example, morbidity rate is the number of new cases of a disease during a specific period. So two very important, new cases and specific period of a population, divided by total number of individuals. So you can call it as total number of population. For example, here assume that you have 100 here. In 100, if you got 20, okay, specific in means in a 1 week. Assume that if it is a 1 week, this we can call it as in 1 week 20 cases have been occurred in total number of 100 populations. That is morbidity rate. And mortality rate is number of deaths, very important. Number of deaths due to given disease, then it is the size of total population of suffers with the same disease. Very important here. See, mortality rate is here how many deaths are happened. For example, you have 100, here I given 100 populations. In 100, assume that 80 are infected. Assume that the 80 are infected, and 30 have died. 30 have died. So this is nothing but the mortality rate. But here it is stopped. It is morbidity rate is nothing but how many new cases are there in total populations. Here we will not say it is total. It is not the infection. It is the total number of populations. Above what we are speaking, it is the total number of population. But here it is the total population we suffers with the same disease. For example, in 100, 80 suffers and 30 deaths. So that we can call it as, that ratio we can call it as mortality rate. Okay. Always we have to talk about the mortality rate. This is very dangerous. See, if this is there, if we can control it, okay. But if the mortality rate is very high, okay, if the mortality rate is very high, then it is very difficult. Okay. So what always we talk about this mortality rate. If it is uh, if it is increasing from 0.1 to then 0.3 mortality rate. So normally we say the human population, it is in dangerous. Okay. If it is increasing, then if it is crossing the 0.3, it is greater than 0.3, then you assume that it is almost 30% of the death. Okay, 0.1 means it is 10% of the death. 30 means it is in between, it means 10 to 30% of the death. If it is crossing 30% of the death, means the emergency, we can call it as the emergency. Because just you assume that in 10 people, if 3 people are dying, okay, means it is the danger for the human beings. Okay. See, we talk about this, whatever the pandemic, okay. Of course, we are very fortunate that it is less than 1%. Okay. It is less than 0.1%, or it is less than 0.1. The mortality rate, what we are talking about, it is less than 0.1. Okay. So then, some of the characteristics of infectious disease is that the infectious disease have a characteristic signs and symptoms. The signs are objective changes in the body. For example, of fever, we already know that. Okay. Symptoms are subjective change, for the examples of pain, loss of appetite, etc. So disease syndrome includes a set of signs and symptoms due to a particular disease. For example, the AIDS patient experiences immunity deficiency syndrome. Okay. So then the characteristics symptoms of the disease develop during the certain phases. Okay. So what will happen is that some of the symptoms of disease develop during the certain phases. Definitely it is going to happen. So the knowledge of the phases helps in the recognition of the disease. Okay. See in what phase it is acting. So that always you have to talk about. Okay. This incubation period and the prodromal stages, period of illness and the period of decline, we will discuss in the tomorrow's class. Okay. So what is this incubation period? For example, if one host is there, okay, if the bacteria is, if it is going to join for the host one, okay, how many days it will be there, how exactly it is going to transfer, and what stage it is going to transfer, that we'll discuss in the next class.